At this time, we will be going over the cardiovascular or heart assessment. By the end of this presentation, you will be able to correctly perform a cardiac exam, correctly identify different types of hypertension, and be able to devise a plan of care for newly diagnosed hypertensive patients. When you first meet your client, you will perform a history, a cardiac history, in fact. The purpose is to provide information about cardiovascular symptoms and how they developed. This will give you indications to potential cardiovascular illnesses or disease states. Be sure to ask about a history of hypertension, elevated cholesterol or hyperlipidemia, and unexplained joint pains. Unexplained joint pains is related to rheumatic fever, and rheumatic fever is a complication of untreated strep throat. It causes valvular damage, which can lead to a condition called rheumatic heart disease, which in time can lead to congestive heart failure. The first part of your cardiac exam is inspection. When you look at the eyes, you want to detect for xanthelasma. Xanthelasma indicates hyperlipoprotein, a high risk factor for hypertension. When you look at the extremities, you want to detect any clubbing, cyanosis, or edema. Clubbing indicates poor oxygen perfusion to distal tissues. Cyanosis is the bluish color in the extremities, which also indicates poor oxygen delivery to tissues. Edema is tissue swelling associated with decreased cardiac function. These are some pictures of what I was describing in the previous slide. In the upper left, you will see xanthelasma. If you note, above this eyelid, you will see a yellow-like deposit that looks like a pimple, when in fact it is not a pimple. This means that there are fatty deposits clogging up the arteries in other areas of the body, but this is its outward appearance. When we see xanthelasma on other parts of the body that are not at the eye, we call those xanthomas. The bottom left is a picture of clubbing of hands. If you note the bulging fingertips and the oval-like appearance of the nail bed. The top right corner is a picture of cyanosis. You will note that the fingertips are bluish in color. In darker-skinned individuals, this is very difficult to detect. You may note that the darker-skinned individual has ashen gray or pale hands. This is cyanosis in the darker individual. The bottom right corner is a picture of pitting edema. You will see that the patient's feet are very swollen. The provider is pressing down to determine the grade of edema. If the provider lifts up his or her finger and there's barely a detectable impression when the finger is pressed into the skin, this is called 1+ edema. If the provider lifts his or her finger and there is a slight indentation and it takes 15 seconds for that skin to rebound, that is 2+ edema. If the indentation is deeper and is taking 30 seconds to rebound, that is 3+ edema. Anything longer than 30 seconds to rebound is 4+ edema. The next step in your cardiac assessment is palpation. Palpate or feel the peripheral pulses. The peripheral pulses include brachial, radial, femoral, popliteal, dorsalis pedis, and posterior tibial. They should feel similar bilaterally, and you should be feeling for these pulses at the same time. You should also note the amplitude of the pulses. Are they strong or are they weak and thready? Auscultation or listening is your next component of the cardiac exam. First, you want to listen for the PMI, or the point of maximum intensity, which is found at the apex of the heart. The apex of the heart is located at the 5th intercostal space, about 7 centimeters to the left of the mid-sternal line. S1 and S2 are the sounds of the heart. S1 is the lub, and S2 is the dub, and the sounds go like this: lub-dub, lub-dub, lub-dub. S3 is an extra heart sound that you may hear. S3 is normal in pregnancy and adults less than 30 years old. It is also normal if the patient is anxious or has anemia and during exercise. S3 is abnormal in people over age 40 and may indicate heart failure. S3 sounds like this: lub-dub-ta, lub-dub-ta, lub-dub-ta. What is blood pressure? Blood pressure is the amount of pressure that blood exerts on the walls of the blood vessels as it passes through them. There are two numbers in a blood pressure. The top number is also known as the systolic blood pressure. That is the blood pressure that is measured during ventricular contraction. The bottom number is also known as the diastolic pressure. This is the pressure measured when the heart is at rest or after contraction of the heart. Pathophysiology of hypertension. It's caused by a loss of elastic tissue and arteriosclerotic changes in the aorta and larger vessels, coupled with decreased capability of arterioles. There are two types of hypertension: idiopathic and secondary. Idiopathic means the cause is unknown in nature, and you will primarily see idiopathic hypertension in most of your home visits. Secondary hypertension means that something else in the body is causing this elevated blood pressure, such as chronic kidney disease or an acute kidney injury. In secondary hypertension, lab studies typically define what is causing this elevated blood pressure. Hypertension is purely defined as the persistent elevation of blood pressure greater than or equal to 140/90. In type 2 diabetes, hypertension is often present as part of the metabolic syndrome of insulin resistance, also including central obesity and dyslipidemia. In all of your patients, you want to make sure you educate them on the risk factors of hypertension. The risk factors for hypertension include genetics. Typically, if they have a family history of hypertension, they are very likely to also have a diagnosis of hypertension. Age. The older you are, the more likely you are to have hypertension. Obesity. Smoking. High fat and high sodium diets. Physical inactivity. High or frequent alcohol consumption, and stress. The classifications of blood pressure will indicate either a normal blood pressure all the way to a hypertensive crisis. So a normal blood pressure, the systolic number will be less than 120, and the diastolic number will be less than 80. For pre-hypertension, you will have a systolic number between 120 and 139, or a diastolic number between 80 and 89. For your patients with pre-hypertension, you can still save them. You will just educate them on increasing their daily activities, changing their diet, decreasing alcohol consumption or smoking cessation. Stage 1 hypertension starts at 140 to 159, or a diastolic pressure of 90 to 99. With these patients, if you persistently see these numbers, you want to educate them on their blood pressure medications and make sure they are taking the medications as prescribed by their doctors. Stage 2 hypertension starts at a systolic blood pressure of 160 or higher, or a diastolic pressure of 100 or higher. A hypertensive crisis means that the systolic blood pressure is higher than 180, or a diastolic pressure that is higher than 110. If a patient is in this range and does not have blood pressure medications to be administered, emergency care is needed and this patient needs to go to the hospital. So now that we've discussed the classification of blood pressure, this chart reviews the target blood pressure on different patient subgroups along with different diseases or medical problems that a patient may have. For instance, if your patient is greater than or equal to 60 years old, their target blood pressure is less than 150/90. If they are less than 60 years old, target systolic blood pressure is less than 140/90. Older than 18 years old with chronic kidney disease, their target blood pressure is less than 140/90. Older than 18 years old with diabetes, their target blood pressure is less than 140/90. Each patient's target blood pressure will depend on their age and other medical problems they may have. In the United States, Medical providers follow specific guidelines from the Joint National Committee, also known as the JNC. This group publishes evidence-based results about the prevention, detection, treatment, and evaluation of hypertension. Here at My Family Cares Home Health, we will use their guidelines in our practice. The following list is a list of complications related to hypertension. It is important that we recognize and treat hypertension accordingly to avoid these complications. A heart attack or stroke. High blood pressure can cause atherosclerosis, which can lead to a heart attack, stroke, or other complications. Heart failure. To pump blood against the higher pressure in the vessels, the heart muscle thickens. Eventually, the thickened muscle may have a hard time pumping enough blood to meet the body's needs, which can lead to heart failure. Aneurysm. Increased blood pressure can cause blood vessels to weaken and bulge, which form an aneurysm, which increases an individual's chance for stroke. Metabolic syndrome. This syndrome is a cluster of disorders of your body's metabolism, including increased waist circumference, high triglycerides, low high-density lipoprotein, which is low good cholesterol, high blood pressure, and high insulin levels. Weakened and narrowed blood vessels in the kidneys. This can prevent kidneys from functioning normally and also results in kidney failure. Thickened, narrowed, or torn blood vessels in the eyes can result in vision loss. Thickened, narrowed, or torn blood vessels are most likely in individuals with high blood pressure. Impaired memory. Trouble with memory or understanding. Uncontrolled high blood pressure may also affect one's ability to think, remember, and learn. Trouble with memory or understanding concepts is more common in people with high blood pressure. Let's put it all together. Let's see this case. MK is a 40-year-old obese female. You arrived to her home because she requested a home visit for following up on her blood pressure check. At her last 2 home visits, her blood pressure were as follows: 128/90, 138/90, and today, 158/92. She reports that she feels okay and denies any headaches, blurred vision, chest pain, shortness of breath, cough, and she denies bowel or urinary symptoms. Let us review MK's past medical history and her chart. Her past medical history includes type 2 diabetes and obesity. She has no known allergies or no known drug allergies. She's never had any surgeries, and her immunizations are up to date. For her medications, she takes metformin 500 milligrams twice a day. Her occupation is she is a teacher. Her social history includes 1 to 2 drinks on the weekend, and she finishes a pack of cigarettes within a week. Her diet and activity. She has fast food most days of the week and goes to the gym once a week to walk. Her last menstrual period was February 5th, 2019. Let us look at the patient profile. Her reviewer systems is non-contributory because she doesn't have any symptoms. She denies everything. She appears well developed. She's obese. She's not in any acute distress and appears to be a credible historian. The physical exam. Vital signs. Blood pressure 158/92. Pulse 86. Temperature 98.1. Respirations 18. Weight 200 pounds. Height 65 inches. Her body mass index is 33.2. Neurologic exam. She is alert and oriented times 3. Cranial nerves 2 to 12 are grossly intact. Head, eyes, ears, nose, and throat. Atraumatic, normal cephalic. Perla. Extraocular movement intact. Oropharynx is clear. Tympanic membrane pearly gray bilaterally. Neck supple, no lymphadenopathy or thyromegaly, no carotid bruits. Heart, regular rate and rhythm, without murmurs, rubs, or gallops. Lungs, clear to auscultation bilaterally. Abdomen, soft, non-tender, non-distended. Normal active bowel sounds. No hepatosplenomegaly or masses. No bruits. Negative CVA tenderness. Extremities. No edema, clubbing or cyanosis. Pedipulses full and equal. Genitalia and rectal exam are deferred. Normal muscle strength and tone. Reflexes equal bilaterally, and her gait is normal. Now this patient profile, all of the things that I have just gone over in the physical exam, a lot of this information is not pertinent to you and includes a detailed provider exam. However, your physical exam will be in your documentation and includes checkboxes that will have pertinent information, and you will check off whatever is relevant to the patient. So a lot of the physical exam you will not have to write out. You will just go ahead and fill in the boxes as they apply to the patient. These are some diagnostics that the patient may be required to have in order to better treat their hypertension. On all of your initial home visits, these diagnostics are very necessary in order to create an adequate care plan for your patients. An ECG or an EKG may show evidence of heart damage and also will create a baseline EKG in order to determine if the heart becomes damaged later on. A CBC is a lab value which will detect any anemias. A CMP, a complete metabolic panel, is also a lab value that will detect the current status of the kidneys and liver, as well as electrolyte and acid-base balance and levels of blood glucose. We also will draw a lipid profile, which will evaluate cholesterol levels and arteriosclerosis risk. An A1C monitors glucose over the past 3 months. TSH is a lab value to detect and monitor thyroid function. Hyperthyroidism can cause secondary hypertension. Microalbumin in the urine will detect early damage to the kidneys. With all of that information, you can kind of start to make up the nursing care plan. The nursing diagnoses include decreased cardiac output related to increased peripheral vascular resistance secondary to hypertension, imbalanced nutritional intake greater than body requirements, risk for unstable blood sugar, ineffective health maintenance as evidenced by patient smoking status. Encourage weight loss through increased physical activity and consume 2-gram or low-salt diet and low-fat diet. For her type 2 diabetes, you want to educate her to continue her metformin 500 milligrams twice a day and encourage her to follow up an A1C and fasting blood glucose so that we may determine if her blood sugars are being controlled. We recommend a low-carbohydrate diet to control those blood sugars. Tobacco use. Strongly recommend smoking cessation. If the patient is not ready to quit at this time, explain the risks associated with tobacco use. The patient education for essential hypertension includes: patient will receive another home visit in 3 to 4 weeks for a nurse visit blood pressure check. You want her to report any dry cough or any adverse reaction to her prescription. Her blood pressure should be less than 140/90, but greater than 90/60. Ask her to monitor daily blood pressure readings at home and log her blood pressure readings, and you will look at them at the next visit. Ask her to engage in 30 minutes of brisk walking on at least 5 days a week. Avoid over-the-counter cold preparations and notify her primary care provider before taking any over-the-counter and herbal supplements. Healthy People 2020 is the federal government's prevention agenda for building a healthier nation for the United States. I believe we can use these goals and objectives to build a healthier nation in Nigeria. Screening for lipid disorders. The United States Preventative Task Force recommends screening women aged 20 to 45 for lipid disorders if they are at increased risk for coronary heart disease. We want to control blood pressure to a systolic less than 140, and a diastolic less than 90. Encourage consumption of healthful diets and achievement and maintenance of healthy body weights. Consume a variety of nutrient-dense foods within and across the food groups, especially whole grains, fruits, vegetables, low-fat or fat-free milk or milk products, and lean meats and other protein sources. Limit the intake of saturated and trans fats, cholesterol, added sugars, and sodium. We also want to limit the consumption of alcohol. Reducing illness, disability, and death related to tobacco use is another goal and objective of Healthy People 2020. Clinicians ask all adults about tobacco use and provide tobacco cessation intervention for those who use tobacco products. Other cardiac findings you will be responsible for assessing include chest pain. Does this patient have chest pain with activity, or does the chest pain happen at rest? If so, do they take anything for the chest pain? Palpitations, tachycardia, also known as a fast heart rate. Is the patient anxious? When is this tachycardia taking place? Bradycardia, or slow heart rate. Is the patient already on beta blockers that may slow the heart rate? Are they symptomatic? Do they seem more tired all the time? If so, their medications may need to be adjusted. Shortness of breath. As we know, the heart and the lungs are very close in proximity. So we want to know if the shortness of breath is being caused by the heart or if there's other problems in the lungs. That is not for you to determine, but we also want you to be able to identify the potential problems. We want you to have good assessment skills and assess these things so that when we bring this information to the providers, they can better care and treat these patients. This is a list of references for your review in case you're interested in looking anything up.